Hi, how are you all? Today came with a new topic, that is bronchitis. Do you have any idea about the bronchitis? Well, let us see about the definition of the bronchitis. Bronchitis is a respiratory condition that occurs when the bronchial tubes. What is the main function of this bronchial tubes? It helps to carry the air to the lungs. In case of this bronchitis, here the bronchial tubes becomes inflamed. After that, due to this inflammation, it causes the tubes to become narrow and it makes us too difficult to breathe. Mainly two types of bronchitis can be observed, that is acute or chronic. Here in this diagram, it will be shown the left side of the body. Here they had taken this bronchial tube. Here this is the normal bronchial tube. Here what happens? It becomes inflamed. So it becomes thick. Thus it obstructs the flow of air. What are the main causes? First one, viral infections. Viral infections such as common cold or flu, bacterial infections like some of the infections like pneumonia and all, and exposure to irritants like tobacco smoke or air pollution and allergies. These are all the main causes that leads to the bronchitis. In this, due to these infections and all, the bronchial tubes will be thickened. In some of the conditions, the bronchitis may result from the complications from some of the conditions like respiratory conditions such as asthma and COPD. In these conditions also, the ultimate complication is bronchitis. Risk factors. Risk factors such as smoking or exposure to the second-hand smoke, like weakened immune system due to the factors such as age, chronic illness and the medication usage. Like if the patients are in usage of medications like chemotherapy or immunosuppressive patients, and exposure to irritants like in case of any air pollution or workplace chemicals, recurrent respiratory infections. If the continuous respiratory infections takes place in these all these conditions, it leads to bronchitis. Types of bronchitis, that is acute and the chronic. Acute means acute in the sense the name itself suggests it is a short term. Here what happens, the air passages that leads to the lungs. It is caused by the viral infection such as a common cold or fever. And in this acute bronchitis, we can observe cough, chest discomfort and difficulty in breathing. But here the patient may be recovered with some of the treatment. Whereas in the case of chronic bronchitis, what happens? It is a long-term inflammation. It often caused by the smoking and exposure to air pollution. Here in this chronic bronchitis, we will observe severe cough, wheezing and shortness of breath. Coming to pathophysiology of bronchitis. Due to the etiological factors such as any bacterial infections or viral infections, what happens? The main microorganism, whatever was infected, it enters into the respiratory tract. During the inhalation and all, in the respiratory tract, the microorganism will be entered. What it causes? It causes the widespread inflammation. Thus, the lining of the bronchi will be get irritated and swollen. The mucus lining will be infected here. In order to make up that cell, the lining, in this lining, the fluid the fluid leakage will be takes place in response to that inflammation. So, during this case, what happens? Coughing reflex. In order to clear that secretion from the lungs, the coughing reflex will takes place. Thus, alveolar fluid response causes the narrowing of the airways. Further, if the secretion thickens, what happens? The ventilation will be decreased. So, here in the airways, the mucus will produce the resistance in the small airways. Thus, it causes the ventilation perfusion imbalance. Thus, the patient won't be able to take the breath normally. Finally and ultimately, it results in the bronchitis. Symptoms. What are the main clinical manifestations we will observe in this bronchitis? In case of acute, the persistent cough. Here, we will observe the mucus or the sputum. Next, shortness of breath or wheezing. During the exercise and all, we will observe this shortness of breath or wheezing. Then low-grade fever and chills and chest discomfort. Whereas in the chronic bronchitis also, we will observe maximum the same things. Along with this, fatigue and weakness will be observed. Here also shortness of breath and wheezing, persistent cough and chest discomfort remains the same. Along with this, fatigue and weakness will take place. Due to this condition, the patient won't be able to get the proper diet. So ultimately, it leads to weakness. Diagnostic findings. Proper medical history must be taken, because if the patient is having any allergic to any irritants, or any infected with any pollution, or any injuries to the lungs, like this complete history we need to take, or any risk of any infections, like that we need to observe, any history of asthma or COPD. Coming to the physical examination, we need to observe for any wheezing or shortness of breath, chest tightness, chest discomfort, like that we need to observe in this physical examination. In case of chest X-ray, we need to rule out how the bronchioles are affected, how the thickening of the bronchioles will be seen, like that we need to identify. But in most cases, we are not able to identify the bronchitis with the chest X-ray. Pulmonary function test, sputum culture and the blood test. In case of the sputum culture and all, if any infections or any microorganisms will be seen, thus we can be able to identify what is the main exact cause of bronchitis. Chest X-ray, we can observe this uh, bronchial tubes, the opacity will be seen. Mainly, the medical management involves using the bronchodilators, corticosteroids, and antibiotics. In case of bronchodilators, what happens if the patient is having this bronchodilators? It helps to open the airways, and it allows the patient to make the breathing very easy. So, it can be taken in the form of inhaler or the nebulizer. Next, corticosteroids. Corticosteroids, what it helps to reduce the inflammation in the airways. Thus, it relieves the symptoms such as coughing and the wheezing. These corticosteroids can be taken in form of inhalers, pills, or the injections. Antibiotics. Antibiotics helps to treat the bacterial infections in case of bronchitis. But if the patient is infected with any viral infections, the most common cause of bronchitis, like any pneumonia and all, we can be treated with this antibiotics. In order to relieve the symptoms and improve the lung function, the therapies will be included, like pulmonary rehabilitation and oxygen therapy. If we advise for pulmonary rehabilitation in during the exercise training and breathing techniques, it improve the lung function and it reduce the further symptoms. Whereas in oxygen therapy, if the patient oxygen levels are down or the saturation gone down, it helps to improve the oxygen levels in the blood. So it reduces the further shortness of breath. Finally, we will see about the nursing management. First of all, first and foremost, we need to assess the condition of the patient, whether the patient is having any discomfort, any fatigue, any feeling, any fatigue, or any discomfort, chest discomfort, or any breathing difficulty. Like this, we need to observe the complete condition of the patient. Assess the vital signs. We need to monitor continuously regarding the condition of the patient and vital signs such as temperature, pulse, respiration, and BP. So we can identify any abnormalities present or not. Provide comfortable position. In most of the cases, the persons are affected with lung problems. Most commonly preferred position is semi-Fowler's or high Fowler's position. In this position, the patient may able to take a breath normally if the patient is suffering with any breathing difficulties. Change the position periodically. In the same position, the patient may feel the distress. So continuously we need to change the position. Maintain the personal hygiene. Due to the further infections or any microorganisms due to hospital infections and all, they may further risk in getting this bronchitis severely. So we need to maintain the proper hygiene using the pulse oximetry and suctioning. If the throat is blocked with any sputum secretions and all, and if the patient is not able to take breath, we need to do the suction. Explain about the deep breathing exercises to the patient. Refer to the physiotherapy if needed. By doing the physiotherapy, chest physiotherapy and all, further complications may be prevented. Provide knowledge about the chronic bronchitis. If the patient is suffering with acute bronchitis, if we will treat in this condition itself, it may prevent in getting the chronic bronchitis. Next, administering the medications as per the physician order, like bronchodilators, antibiotics, and mucolytics. These are all the medications. So we need to observe the patient whether they are taking or not, the correct dose they are maintaining or not, any further effects after using the medications. Like this, we need to completely identify the things and we need to inform to the physician immediately. The proper health education and family support must be provided in order to prevent the further symptoms and in order to get rid of the depression. Next, prevention and management. How we will manage this bronchitis? Complete rest and proper diet and plenty of sleep must be provided. Drinking plenty of fluids such as water, tea, and soup. What it causes, it helps thin the mucus and keep you hydrated. Use a humidifier or take a steamy powder. It also helps to loosen the mucus. Avoid the irritants such as smoke, dust, and fumes. So further symptoms worsen may be prevented. What are the preventive measures we can take in case of this condition? Wash the hands frequently with the soap and water or use hand sanitizer. It may reduce the microorganism risk. Avoid smoking and exposure to second-hand smoke. Get vaccinated for the flu and pneumonia. Due to the infections, viral infections like flu and pneumonia, the bronchitis will be caused, right? So we need to get vaccinated against this illness. Avoid exposure to air pollution, chemicals, and other irritants. Due to the air pollution and other chemicals and all, the lungs will be affected easily. So we need to identify the cause and we need to treat according to that. So if you are having any doubts, please keep the please please do type in the comment box. Thank you one and all.